The effects of coping self-efficacy on worker stress. Worker stress is one of the most studied areas in IO psychology. Why? Because it can impact work behavior, employee health, job satisfaction, and can even cause burnout. Now, research has identified certain characteristics that increases one's resistance to stress, and one of them is self-efficacy. Now, what affects self-efficacy's impact on situations involving stressors such as work overload and role clarity, or we can also call that job ambiguity, is a choice of coping methods. Experiences that I had that affected my self-efficacy and job satisfaction was a clinical volunteering position that I had. The first incident involved a CNA screaming at me in front of a patient because I was trying to help her and using techniques that I was taught during my training, but it wasn't the way that she did things. The second incident was when I was told that I was allowed to go into a sleeping patient's room to change the batteries in his heart monitor, but then he woke up midway and he was very upset that I was in his room. He accused me of trying to steal his things and lying to him, even though I was trying to explain to him why I was there. The overall experience I had with the staff wasn't that great either. A lot of the nurses were unfriendly and they didn't want to teach or be patient. I had no identity of my own when I was on my shift, and I was just known as the volunteer because no one bothered to learn my name at all. So even though I was very excited for this volunteering opportunity, my experiences with the patients and nursing staff made it pretty much miserable for me to be there because I was giving up 4 hours of my time to offer them this help, and I was basically being treated in a way that I didn't want to be treated. I felt extremely stressed out whenever I had a shift coming up, and so I would reschedule a shift, I would miss my shifts, I would just do everything I could to avoid going because I was just so scared of messing up and getting yelled at and basically have my day ruined every single time I go to a shift. So what exactly is self-efficacy? Self-efficacy is an individual's belief on whether or not he or she has the skills or abilities necessary to engage in a course of action that will bring about a desired outcome. It is related to one's feelings of competency and effectiveness. The concept of self-efficacy not only pertains to one's abilities to cope under stressful situations, called coping self-efficacy, but it also relates to one's ability to do his or her job, called job-related self-efficacy. It can have positive effects in reducing the stress that comes from work, and in one research it was found that individuals who had a sense of control over stressful situations were only able to decrease their stress if they had a high sense of self-efficacy. A correlational study was done to test and see if the moderating effects of self-efficacy would be highest in those who had active coping skills and low levels of avoidance coping. Survey data was collected from the Walter Reed Army Institute of Research and the U.S. Army Research Institute. The survey had 4 different scales that included stressors, psychological strain, coping, and self-efficacy. The stressors in this particular study were work overload and role clarity. The results from the study show a negative correlation between self-efficacy and psychological strain, a positive correlation between avoidance coping and psychological strain, and a negative correlation between active coping and psychological strain in the random coefficient model. The study states that the impact of self-efficacy on stressor-strain relations, stressors in this case being work overload and role clarity, and strain being psychological strain, may depend on one's coping methods, active versus avoidance coping. For those with the highest self-efficacy, using active coping skills will be the most beneficial when trying to deal with stressors. This is because these individuals believe that they are able to positively impact their situation. However, if the same individuals were to rely on avoidance coping, their high self-efficacy would probably not even make a difference. From my experience, although I had high self-efficacy in the beginning, my experiences caused me to question my skills, lowering my self-efficacy, and causing me stress and lower job satisfaction. I chose to deal with it via avoidance coping, which instead of helping, caused me to stress out even more because I was missing my shifts, thus putting me behind on the hours I needed to continue on a different floor. For me, active coping would have been to continue volunteering, being more careful, not taking on too many tasks at once, double checking to make sure what I was doing was correct, and thus validating my abilities to myself. Instead, I chose to avoid it completely. I was just way too scared of facing those situations again out of fear of not knowing what to do and getting yelled at. So all this eventually became too stressful and miserable for me to deal with, and I eventually did leave my position. Worker stress could lead to job dissatisfaction and burnout. It can be resolved by improving one's self-efficacy and promoting active coping styles. To increase self-efficacy, improvement in employee training and orientation programs can be done. For me, some of the do's and don'ts that I experienced were never covered during training, so when faced with them, I had no idea how to approach the situation. To increase active coping, cognitive reconstruction came in use. Cognitive reconstruction helps change the way one thinks about stressors, so instead of seeing stressors as a threat, one may start to see them as a challenge instead. Providing a supportive, team-oriented work environment will also help. In this case, if the nurses were more willing to help out the volunteers by teaching, both parties will be more able to give good quality health care. There is also a significant amount of research that shows that the support of colleagues helps reduce the stress. This also relates to communication. If the nurses were more patient and clearly communicated what they wanted done in a calm manner, this would have also helped greatly.